Okay. Need to share my screen. Okay. I am on, let's see, what chapter am I on here? Chapter 11. So here's where we're going to start. Okay. I'm sharing my screen so I can only see a few people. Okay. So what we're going to start with is using health education and groups in the community. So tell me why you guys think that, why is so much of our public health positions and roles as nurses focused on education? Why would you think that would be true?
Is it to prevent diseases?
Mhm. Yep. Yep. And promote healthy lifestyles, prevent diseases. Absolutely. What else?
To create awareness?
Yep. hmm So if you look in your outline here, this is, remember, this is a summary of your PowerPoint, right? Okay. So we go through the educational process in this chapter, identifying educational needs. How do we establish goals and objectives? How do we, what are some educational methods we could select from to use? What should we have as skills as an effective educator? How do you do motivational interviewing? And then how do we develop effective health education programs? And then we'll talk about barriers. What are some educator barriers? What are some learner barriers? Okay. And then here's your objectives. So after we go through this chapter, you should be able to discuss, identify, describe, explain. You should be able to articulate these objectives. That's at least how I do it with my class for Dr. Lundy's students is we review the objectives and you should be able to answer those questions, be able to discuss the ways people learn, the different ways. There's 3 different ways that people learn. What are the steps and principles that guide health education? Right? Why is literacy so important with education? And then how do groups function? Okay. So I've already been through this chapter, so I've already highlighted the key things that we need to pull out, key concepts, and we come up right away with Healthy People 2020. Healthy People 2020 in every chapter has goals and objectives or examples in this chapter related to health education. So there's 4 of them, and so you need to be aware of these. Okay, I'm not going to read through them. I've asked you guys in your preparation for today or in your review and studying for the next exam to please be familiar with the Healthy People 2020 boxes, but they are related to health education. Okay. So I want to read this. This gives us a summary of the whole chapter. So in designing, implementing, and evaluating health education activities, it's important to learn about primary health problems in the community, as well as the education principles related to both learning and teaching. The goal of educational program is to teach what people think they want to learn in ways that facilitate their learning. Remember, everybody learns differently. Every one of you in this group learns differently. Right? We always want to have learners participating and identifying what their needs are. Okay. We develop education programs to meet the needs of the population we've identified. The most important thing, the number priority is that we always have to identify first the population that needs to be educated, right? You can't come up with an education program if you don't know the population that we're dealing with. Okay. Programs involve education about health promotion, health prevention, illness prevention, and treatment. Right. So here's an example the book gives: the community in which childhood and adolescent asthma is a problem. Right. There may be a community-based asthma education and training program that's developed. right? If childhood obesity is the issue, there may be a program developed, let's say in the schools, that works with primary, secondary, tertiary interventions with regards to obesity, right? Primary being education for prevention of the risks of obesity, right? There may be activities in school in which we try and screen for high-risk kids, right? And then if we identify that there already is a group of obese kids, then we can work with them about how to manage their obesity, right? And the long-term effects, and why they should learn about healthy eating and diet and exercise. Okay. So that's what the education looks like. Do you guys know the difference between education and learning? What do you got without looking at this? Does anybody know the difference between education and learning? There's a difference. Okay, so when you're being educated, like I'm doing with you now, I am giving you knowledge, right? Education is an activity designed to help people change their knowledge, attitudes, and skills about a specific topic. Okay, learning, on the other hand, oh, I'm sorry. Yes. Hello. Somebody need to say something? Okay. In your PowerPoint for this chapter, the PowerPoint slide for this is excellent as well. It gives a nice summary, right? So with learning, you're supposed to take that knowledge and then a change is expected. All right. So learning involves change, and change is difficult. So it's one thing to be educated, but learning actually means you're going to put that education into practice and make some changes. Okay. So there's for the purposes of this chapter, we have three natures, the nature of learning. Okay. We think about it in three different ways. Okay. It's here on page 184. We talk about cognitive learning, affective learning, and psychomotor learning. Okay. So the cognitive is about thinking, affective is about feeling, and psychomotor is about acting. And we'll talk about these three a little bit more as we get further into the chapter. But we have to understand these three learning domains in order to be able to develop and plan for effective health education. Okay. So briefly, the cognitive domain, here's what it includes. Memory, remember it's thinking. Okay. So it includes memory, recognition, understanding, reasoning, application, problem solving. Okay. So it's the thinking part. Okay. And then the affective includes changes in attitudes and the development of values. All right. We know that it's extremely difficult to change deeply rooted attitudes, beliefs, and interests and values, right? To make such changes, people need encouragement to change. Does anybody know a person that falls into this right here? I do. I know several of them in my circle that it's really hard to change deeply rooted attitudes and beliefs. Would you agree? And then psychomotor, that is the doing. So in the psychomotor domain includes the performance of skills that require some degree of neuromuscular coordination, essentially your teach back method. Okay. Okay. So you teach clients a variety of psychomotor skills, maybe including bathing infants, changing dressings, giving injections, right? And then you're going to want them to teach that back to you. So the psychomotor is actually doing skills. Okay. Our competency for this chapter, I go over this with my students. There's a CUSIN box. CUSIN stands for quality and safety education for nurses. And in chapter 1, we went, and you actually had an exam question in exam 1 about what are these 6 competencies. So each chapter goes through different competencies. This one is client-centered care. And if you read through this, it addresses health education, providing health information. Okay, so have a look at this box. Really helpful information and pulling it all together. Okay, so there are 5 steps. So the education process built on an understanding of education, learning, and how people learn. Okay, and so there's 5 steps of the educational process. Okay, the first is identifying educational needs. And that's essentially doing your needs assessment. Okay, and box 11.1 goes through how to do a needs assessment. Okay, so there are factors that are going to affect what the needs are of the people that you're going to be teaching. Okay, demographics, physical, geographic, economical, psychological, social, spiritual characteristics. Those are going to affect as far as, and also the knowledge and skills and motivation to learn are also going to affect your health education. You know, what if you're educating a group of hearing impaired? Well, you may need more visual materials. Okay. Second, identify educational needs. Second, in the process is establishing educational goals and objectives. Right. And think of ADPI when we're doing this. This is identifying the educational needs. We're just essentially going through ADPI, and we're thinking of ADPI in terms of providing health education and developing health education programs. So, and the second part would be to establish goals and objectives. So after we identify the needs, we then develop goals and objectives for the educational program. You guys know what goals and objectives are. And then we select the appropriate methods. Okay. Okay. We have to know our audience first to see what the goals are, what the objectives are, to be able to select our methods. Right. They also need to be selected based on the group of learners and the education of the educator. Right. We want to choose the simplest, clearest, and most succinct manner and presentation. All right. And again, everybody learns differently. Okay, some people learn by actively being involved. Maybe they like openly dialoguing during a education session. Some people like role playing, simulation, games, group participation, demonstrations. Right, and then others just like to learn alone, watching a video, listening to a guest speaker, reading printed materials. Okay. I like this teach mnemonic and box 11.2, how to teach effectively. Tune in, edit, act, clarify, and honor. This is an excellent mnemonic to remember when doing that, when teaching. Okay, some other information about what we need to consider when we are choosing our educational methods. We need to consider age of the group. Are we going to teach preschoolers, or are we teaching adults, or are we teaching elderly? Gender, culture, developmental disabilities, special learning needs, educational levels, knowledge, size of the group. And here's my example of hearing impaired and visually impaired. Right? People of hearing may need more visual material. People of visual impairment maybe need more verbal description. Okay, what about a group that has a short attention span? Right, you got to be creative. How are you going to keep them focused? Do they need breaks? Do they need little to no, try and have little to no distractions. Okay. And here's our levels of prevention. Okay. Let's go through these, make sure we understand these. So at primary, and again, this is education, developing education programs. So education at health fairs regarding immunizations for children, other adults, and people with chronic diseases or older adults. Right? Do we all understand why that's primary? Because we're taking the opportunity to try and teach about immunizations for kids, older adults, and people with chronic illnesses. Secondary. Okay. Secondary, early diagnosis and treatment. So education at health fairs regarding early diagnosis and treatment of diabetes, along with providing health screenings with the goal of shortening the disease duration and severity. Do we all understand why that is secondary? If you don't, speak up. So we need to clarify that. And then tertiary, right, is working with people that already have a disease or an issue, a health issue. So here, education in rehab centers or adult daycare centers to help individuals who have had a stroke maximize their functioning. So the group is people who've already had strokes. And what are we doing for them? We're trying to educate them and teach them how to maximize their functioning. Do we all understand that? Okay, this is important. I want you, we need to study this. You need to study this. How to. How do we use plain language in health education? So the how-to box in 189 is an excellent resource to try and pull this all together. Okay, how do we organize the audience? How do we choose our words carefully? And how do we make information easy to find? And it gives lots of examples. Okay. Has anybody ever developed an education program in their work or participated in a group that developed an education program? I've got 2 classes here. So lots of people to pick from. Let's see, I've got 31 participants. Anybody ever participated in developing an education program for a group of clients?
Nope.
I did, not in the medical field.
Okay, what'd you do?
It was in the restaurant business and it was training management.
Okay. Okay. And did you have to assess your audience, assess how they learned, what did you do?
Oh yeah, you definitely have to assess their learning styles
Mm-hmm.
and then incorporate everybody's learning style into the way you instruct.
Mm-hmm.
Very difficult.
Yeah. Let me ask it a different way. Have any of you ever been to a training session, a large group training session,
Yes.
like an orientation for a new job?
Yes.
And how was that? Did everybody learn differently? Did lots of different kinds of tools need to be used to pull that off?
Definitely. Everybody learns differently.
Absolutely. That's exactly what we're talking about here. So think of that educational event that you went to. That's exactly what we're talking about. Now we're putting you as the coordinator of that, the developer of that, and all the things that when you went to your educational sessions, whether it was for a new job or continuing education in your current job, the people that put on this program for you, this is what they had to do. These are the things that they had to consider. Make sense? And then barriers, right? What are some barriers? Well, we know that we have different barriers to learning. What do you guys think are some barriers?
You got language barriers.
Absolutely.
Education level.
Education level, language, maybe cultural.
Culture.
Yeah, cultural, ethnic backgrounds. Then we have We have Generation Xers, we have baby boomers, we have, right? Everybody learns differently, right? So some educator related barriers. So let's say we're putting it on, right? Do we have a fear of public speaking? Do we lack credibility with a certain topic? Do we lack professional experience? Right? How do we deal with difficult people in our group? Right? What if we don't have a lot of experience and we don't really know how to pull everybody in, pull everybody together? Right? Are you, is the instructor uncomfortable when somebody asks questions? Right? And then with regards to learner barriers, the two most important learner related barriers are low literacy and lack of motivation. Okay? So low literacy and lack of motivation to learn information and make the needed behavioral changes, right? Nurses often deal with individuals and populations who are illiterate or have low literacy levels. And sometimes we don't know that, right? So there are a couple of models that we can use when we're using our teaching programs. The first one is the health belief model, the HBM. And this model is particularly used if you think that motivation is going to be a problem. Okay. And it goes through 6 different components, which we don't need to memorize, just knowing that the HBM model deals with motivation. The M in it to me is motivation. That's how I remember it. And the 6 components that you answer questions on what motivates an individual to do something. So that's how I remember that one. The HBM is motivation. Okay. And then there's another one called the, these are used interchangeably. It's called the TTM, the Trans Theoretical Model, and the Precaution Adoption Process Model, PAPM. Okay. And these in particular do go through 6 different stages. Okay. This is more of a more complex training model, where you go through pre-contemplation, contemplation, preparation, action, maintenance. And then the person terminates the change process because he is able to continue with the new, more health conscious way. Okay. And then how do we evaluate? So we're just at the end of the ADPI here, right? How do we evaluate the importance of the educational process? Right? We know that evaluation is a good way to improve the educational program, right? That's why we do surveys, right? At the end of all our programs. Here, can you do this evaluation for us? Did the objectives meet the learning needs? Did the instructor teach you what he or she said she was going to do? Okay, evaluation is really, really important. By the way, all you guys know that your midterm evaluations for this class are in your shell. So if you could take a minute and go fill them out, we would certainly appreciate your feedback. Okay. We don't need to go through this part, but I do want to review this. So let's say you're working in a group like you have been, with a couple of projects during this term in this class. I just want to review examples of group role behavior. So in a group, these are kind of formal names, but think to not only the couple of group projects you've just done, but also other group projects have done, other classes. There are different roles in groups. Okay, there's follower, gatekeeper, leader, peacemaker, task specialist. And see, for me, I like to be the leader in the group. I like to guide and direct the activity. Okay, does everybody have a place where they can see themselves fitting in these roles and groups?
Yes, ma'am.
I want to be the leader. Sorry, I just do. Okay, and then the last part of this chapter I want to go over, have you guys review. I want you to review box 11.6. These are core competencies for communication skills for educators. Okay, these are excellent. Okay, goes through communication skills and goes through attitudes. Okay, so have a look at box 11.6. Okay, so any question about using health education? The next chapter we're going to go through talks about how we do a community assessment. Okay, so we're going to move into chapter 12. How do we do a community assessment and evaluation? Okay, just want to make sure I cover things I've written down here. So here's your chapter outline, and your chapter outline is essentially your PowerPoint, right? Your PowerPoint just describes this chapter outline in a little bit more detail, but you have it ahead of time to hopefully have a look at. So let's figure out how we're going to get, how would you think, how do you think we do a community assessment? Let's assume that you have just been hired as a brand new community health nurse. You're going to a community that you know nothing about. In fact, it's in a different state. Okay, but you're it. Okay, and you're starting your job tomorrow. Okay, what do you want to know? How are you going to do a community assessment? What do you guys think? What's important?
I mean, I would do a windshield survey if I could. I would
Yep.
talk to the community, find out what their issues or biggest issues and concerns are. I
Yep.
would also assess or look for what is that, like data.
Yep. Gather data. Yep. Yep. We're going to talk about that. Data generation, data generating versus data gathering. That comes up in this chapter as well. Yep. What else? Would you like to know about the population? Is it a young population? Is it an older population? Would you like to know what the history is of the community? You probably want to know everything, right? You've been asked to do a community assessment. Okay. And how are we going to use the AdPie and tie it into a community assessment? Let's say you're doing an assessment of an adult entering the hospital. You're doing an assessment AdPie that way. Now we have to shift that thinking into you're now doing an assessment for the whole community. Okay, AdPie remains the same. It just looks different. Okay. Okay. So the nursing process from assessment through evaluation is used to promote community health. Kind of what I just said. Process begins with a community assessment. Okay, community assessment is one of the core functions of public health, which involves getting to know our community. Right? So a community assessment is basically a systemic approach to identifying community needs, clarifying problems, identifying community strengths and resources. Okay. And here's a definition of community. Okay, community is a group of people who have a common characteristic. Communities can be defined by location, race, ethnicity, age, occupation, interest in particular problems or outcomes, or other similar common bonds. Whoops. Okay, so what are the three concepts of community? Okay, the three concepts of community are here in table 12.1. We need to know these three. Okay, this helps us organize our entire community assessment. They are place, people, and function. Okay. Okay, let me read you a summary of this. Community refers to dimensions of place, people, and function. So when we are measuring the dimension of people, okay, how would we get that information? Right, we may get that information from census, right here. Tourist Bureau, civic groups. So this is where we're getting our information. Okay. And again, we're talking about people here. Okay. Look at all the places we might get our information if we want to get information about the people, the population. Okay. If we wanted to look at place, right? What are we looking at? What are the geopolitical boundaries? Is there a local name for the area? What's the size of it in square miles? Here's where we might get that. Okay. And then function. What is the community about? What do they produce? What do they distribute? What is consumption of goods and services? Okay. Are they an industrial community? Are they a college town? Are they agriculture? Are they, I don't know. We have to find that out. And here's where you might gather your information as well. This last column is examples of data sources. So here's what place might measure, people might measure, and function might measure. And here's your sources of data. Okay, so we have to understand that. What are the three concepts that make up the community? Place, people, and function. Okay. So we also need to know this. How do we identify community systems? This is 9 categories that are found within communities. There are many more, but this is the 9 that are recognized. So what this means is all of these 9 are in every community. This is the basic makeup of the community. Okay, categories, basic makeup. But politics and government may be a priority in one community and not as much of a priority in another. Safety and transportation, again, may be a priority and in one community and not in others. Okay, education, physical environment. Okay, so we need to know these 9. Okay, what are the common characteristics that make up a community? Here's your list. Okay, I'm on page 205. Okay. So I just want to mention this to you, the status of a community. Community health, in terms of status or outcome, is the most well-known and accepted approach. It involves biological, emotional, and social parts. Okay, biological, that is typically measured by morbidity and mortality, life expectancy, risk factors. Okay. Structure. Actually, let me go back here. Okay, this section is the goals and means of community-oriented practice. Okay, so we look at the status, which is what we just went through. We look at the structure. Okay, structure is defined by what kind of resources, what kind of services and resources are made up in the community. Okay, and then the process. How does the community function? That's what the process is. Process, the view of the community health as a process of effective community functioning. Okay. So those are the three: process, structure, and status. Okay, those are the three things we look at in community-oriented nursing. Okay. And then here it is summarized in table 12.2. Okay, and it's even more specific. So the status, what are the vital statistics? What's the incidence of what are the leading causes of morbidity and mortality? Okay, and where might we get this information? Okay, and then the structure, how is it made up? Okay, and then the process. How does the community function? Okay, so we need to be aware of those three. Okay. Okay, and then we need to understand the difference between active and passive partnerships. I'm on page 209. Okay, so we know that community partnerships are key to communities functioning. Healthy communities functioning need good partnerships, right? They need partnerships with community members to meet the community goals, right? Because here it says community partnership is necessary because when there is community partnership, community members also have a vested interest in the success of the efforts to improve the health of their community. Okay. So what are some examples of community partnerships in your communities? Do you guys have local sports teams that partner with the schools? Okay, most changes aim at improving community health through active between community residents and healthcare workers from a variety of disciplines. So for an example, an active partnership would be a local company providing after-school meals for school-age kids. Okay, that's in there, it's doing something right there, right then, that's affecting the community.
So like a Boys and Girls Club.
Yeah, yeah,
Okay.
yeah.
I'm sorry, I didn't understand the question at first. I had to think
I'm
about it.
sorry.
I'm sorry.
No, that's exactly right. And a passive would be kind of doing things behind the scenes, right? Where you have groups that are assessing, planning, and implementing needed community changes, right? So your task force, your groups. Then your active participants are in there doing things daily for the community, for the benefit of the community. So those are your two differences. Okay. Then here's our Healthy People 2020. Talks about community consortiums and partners. So have a look at that. Okay. So we know we've already talked about this, but community assessment is one of the core functions of public PHN is public health nursing. right? Community assessment on 3 core functions of how we critically think about the community. Your QSIN box here, your targeted competency is your client-centered care, right? So have a look at that. Okay, it talks about community assessment. Okay, so when we're doing a community assessment, we are either trying to understand, we can be looking at the community as an individual, a community assessment as a family, or some aggregate of the population. Does that make sense? It doesn't necessarily mean the whole community. The community we might be working with, maybe individual families. Make sense? We need to be able to know what community strengths are and what the resources are available to help solve the problems. Right? And we go through the nursing process. Right? So community assessment helps to identify community needs, to clarify problems, to identify strengths and resources. And here's how we go through it. Just think of your ADPI. How do we assess the community? Gathering relevant existing data and generating missing data. Okay, so that's what we're going to talk about. Data collection. Are we data generating? Do we need the data? Or do we already have the data? Okay, so that's in our data collection. So it's right here, data gathering and data generation. So if we're gathering data, this is the process of obtaining existing readily available data. So we may be able to get that from the Census Bureau, where it's the age, what's the gender, what's the racial distribution, what are the vital statistics. Okay, so we're gathering data that already exists. Where data generation is we're having to generate data. So this information does not exist. And we can only gather this information through interactions with our community members. Okay. Sometimes this can be more difficult to gather because we have to, hang on. One sec. Who do I need to mute? Whoever's not muted, could you mute yourself, please? Trying to find somebody that needs to be muted here. I can't. Okay. For all of you that have come in the last 10 or 15 minutes, if you could please put your name in the chat, I'd appreciate it. So data generation, here's how we get it. Okay. How do we get information about communities' knowledge and beliefs? Or as we're gathering information, here is some of the information we may need to gather from the community. What are their values and sentiments, goals, perceived needs, norms? What's the power structure of their community? What's the leadership structure? Okay, so that's the difference between data gathering and data generation. You get that? Okay, and then here's some data collection methods that we may need to use. Informant interviews, participant observation, windshield surveys. Okay. And then here is a nice table. 12.3 is a great description of what a windshield survey is. The most important tool you will have with regards to a community assessment is your windshield survey. Okay. What is a windshield survey?
That's just gathering data and
Mhm.
information about a community just riding around looking through your windshield. Taking somebody, of course, letting somebody drive, and
Right.
just gathering data, what the weaknesses is, the strengths, what the neighborhood is
Yeah.
like, what resources are available, how many hospitals are in the area,
Mhm.
daycares, things like that.
Are people gathering on the corners? Is the community dirty? Is it clean? Does it have nice parks? Does it not have nice parks? Or people walking around freely? Are they not? You can be doing this from the windshield of anything, windshield of a bus, windshield of a car. That's why it's called a windshield survey. You are riding around the community doing all your observations. Okay. And then the last part I want to go over is, who are your key informants? Who would you like to talk to? Remember, you are new to the community, and it's going to help if you have some kind of key stakeholders to talk to find out about the community. Who would you like to talk to? Well, I'd like to talk to the county health department, right? The nurses that work in the health department, find out what's going on, right? What about church leaders? I'd like to talk to church leaders, find out what does religion look like in this community? Right? I probably want to talk to some people in education, parent teacher, presidents, right? What does education look like in your community? Maybe politicians. I'm not sure if we want to talk to politicians all the time, but maybe government employees, right? Key government employees. And maybe even the mother who organized the local chapter of Mothers Against Drunk Driving. Right? So there's lots of key stakeholders in your communities. What about law enforcement? Right? Might you want to talk to law enforcement about your community? Is it a community that has a high crime rate? And what's being done? Right? So there's a lot of things involved in community assessment. And then what about as you're doing your community assessment, here's some things to think about when you're looking on websites for community information. How current is the information? When was it last updated? How credible is it? Right? So here's some things to think about. Okay. And then the last thing is, how do you gain acceptance into a community? Okay. Or gaining entry or acceptance into the community is the biggest challenge, right? A lot of people, they don't know you. They don't know why you're poking around asking all these questions, right? You're considered an outsider. They might think that you're being represented by a healthcare system, and just asking questions that they don't think you should be asking. Okay, so you have to establish. We've talked about this before. One of the biggest ways to gain acceptance is trust. Right? You have to be able to gain the trust of your new community, right? If you don't gain trust, you're not going to be able to do an accurate assessment. Okay? Here's a couple of suggestions of the way to gain support, gain trust. Take part in community events, look and listening with interest, visiting people in leadership positions, keeping appointments, clarifying community members' perceptions, respecting an individual's right to choose whether he or she will work with the nurse, and then obviously maintaining confidentiality. Okay? So that's how we do a community assessment. Does anybody have any questions about how to do a community assessment? It's pretty complex. What do you guys think? Lots of things to think about, right?
A lot.
Do you think you could get in there and do one?
Absolutely.
Yeah, be kind of cool. Obviously the goal of community assessments is pulling in the community to help you. They're part of your team as well. They're going to buy into it more when they're part of the process, right? People want to help. I mean, look at all the volunteers that you already have in your own communities, right? People want to help. Okay, let's move into economic influences in healthcare. Okay, what are some factors affecting healthcare? Okay, so we're talking now. Shift your brain to economic influences. What is economically affecting our healthcare system as a whole? We have the uninsured. We have the poor. We know that access to healthcare is a problem, right? What are some factors that influence healthcare costs? Well, demographics, technology, chronic illnesses. And then how do we finance healthcare? What's considered public support, public health, other public support, private systems? A lot to think about as far as the economics of healthcare. Okay, and again, have a look at your objectives. You should be able to answer these after we cover this. Okay. Okay, we all know that poverty is directly related to poorer health outcomes. Do we not? Are we all in agreement with that? Okay, poorer health outcomes lead to several things. Lead to reduced educational outcomes in children. They lead to poor nutrition, low productivity in the workplace, and unstable economic growth in a population, community, or in our nation. And this is crazy to me. Approximately 97% of all healthcare dollars are spent for individual care. Okay, where only 3% are spent on population level healthcare. That means preventative. Okay. The United States spends more money on healthcare than any other nation. And we obviously know now that the current healthcare system is at a point now which it's not affordable. Right. And that's important in public health because public health is usually in a position where we're the ones who are allocating resources, right? Allocating dollars to solve problems, right? To plan, design, coordinate, and evaluate community-based health services and programs. How do you prioritize? One community may have significantly different needs in another community. So it's difficult. Healthcare economics right now is really, really challenging. All right. Well, economics, we know the science concerned with the use of resources. Okay. Health economics is health resources. Public health economics is public health resources. So that's just the quick definition of health economics and public health economics. Okay, this is important. Although the public health system has been considered for many years to involve only government public health agencies, such as, let's say, health departments, right? But now the public health system in these days is much broader now. It includes schools, industry, media, voluntary organizations, civic groups, police and fire departments. Really branched out. Public health used to be just governmental public health agencies. Now it involves really the whole community. Okay, and what are some factors affecting resource allocation? Okay, the uninsured. Okay, we just need to know what the factors are. Okay, you don't need to memorize everything about the uninsured. We need to know that what drives it is the uninsured, the poor, right? We know that socioeconomic status is inversely related to mortality and morbidity for almost every single disease, right? Poor Americans with income below the poverty level have a mortality rate 3 times that of middle Americans. And then access. Access is also an issue. Okay, we know that the families living in poverty have less access to health services. They don't have the funds. And what if they don't qualify for Medicaid? Okay, what if they don't get approved for insurance? What if they lose their job and don't have insurance anymore? And then the rationing, the other factors is rationing of healthcare. We don't really want to think about that, but what is it? It implies reduced access to care and potential decreases in resources and acceptable quality of care. But that is part of it. And then here's your 2 Healthy People 2020 goals. So page 129, please have a look at these. Right? One of them is increase the proportion of individuals with health insurance, reduce the proportion of individuals who experience delays in obtaining medical care, dental care, prescription medications. Okay, and here's our prevention box in this chapter. Okay. So have a look at that. And if you don't understand why each one is primary, secondary, and tertiary, let me know. Okay. We don't need to go through the phases. Quality and safety education for nurses competency in this chapter talks about teamwork and collaboration. Have a look at that box. Interesting information. Okay, just a few factors influencing healthcare costs, demographics. What is the biggest demographic that is affecting healthcare? What's the biggest demographic?
The aging adults.
Why?
Well, because all of the baby boomers have now reached the age of retirement, and so they're all saturating the healthcare system.
And what is a majority of care that they're using the resources for? Chronic illnesses, right? So demographics. Although many older adults are independent and active, they're likely to experience multiple chronic conditions. Okay. And then they talk about chronic illnesses. Chronic illnesses is a new factor affecting healthcare spending. Chronic disease accounts for 70% of the deaths in 2010. Okay. And then the last section of this chapter is how do we finance healthcare? Well, we have public health support from the federal government, Medicare, Medicaid. Okay. Table 8.3. I know you've seen this in other chapters, but here's a nice summary of the few important differences on Medicare and Medicaid. Who can get it? Federal or all state, government affiliation, Medicare is federal, Medicaid's run by the states, and types of coverage. And then it goes through Medicare, talks about Medicare and Medicaid. Okay. And public health is another financing option. So most public government agencies have a Annual budget. Okay, these are your local public health departments, right? They're the ones, public health agencies will do the supplement the WIC program. Okay, they may do immunization programs, or at least allocate the resources they have for programs in the community. Or if they have a low immunization rate, maybe they allocate their funds to immunization clinics. Okay, and then another source of how we pay for it is TRICARE. Right? Everybody knows, you guys know what, if you're in the military, you know what TRICARE is. Right? It's either the health services for military independence through TRICARE or the VA. Okay, and then you have your private health insurances that you typically get through your employers, or you can purchase them through co-ops. Okay, so those are your 4 kinds of ways we can, it's financed. And then this whole last section is the HMOs and PPOs and all of that. We don't need to get into that. I just want you to know the four the ways we pay for healthcare.
So the 4 would be TRICARE, private support, Medicare, and Medicaid,
Nope. The 4 would be public.
public.
4 would be public.
I got public.
Hang on. And under public is Medicare and Medicaid. So public
Okay,
is first. Okay, page 138. Medicare and Medicaid is under that section, so that's public. And then you have public health, which is your local public health departments, right? That do the WIC programs, the immunization clinics, the parenting classes. Okay. And then your other public support is your TRICARE and VA.
okay, thank you.
Yep. And then the last one is private. Okay. And private involves a lot of things, but I just want you to know the 4 ways healthcare is financed. Okay. Any questions about that? Okay, let's jump down to a couple of difficult chapters. Okay, these chapters are, let's see. You doing okay? Everybody doing all right so far? All right,
Yes.
let's get into violence and human abuse. Okay. So we're in chapter 25, page 433. Okay, what are some social community factors that potentially influence violence? This is all on your PowerPoints right here. Okay, well, work can affect violence, education, universities, schools, media, religion, population. What types of violence do they address in this chapter? Homicide, assault, sexual violence and rape, and then suicide. And what does family violence look like? Family violence and abuse. How do you identify abusive patterns? What are some types of family violence, and what does elder abuse look like? Okay. For purposes of this chapter, they define violence as non-accidental acts, interpersonal or intrapersonal, that could result in physical or psychological injury to one or more people. Right? Violent behavior is predictable and thus preventable, especially with community action. Okay, and Healthy People 2020 comes up right at the beginning of this chapter, 434. And they have 7 objectives for reducing violence. We need to know what those are. Okay. And then it goes through each section. You can read through each section of the factors affecting it, but what's more important is you know what factors are affecting violence. Okay, so you can skim through each of these, but work, what do you think of when you think of work? I think of workplace violence, right? So remember, the topic is violence, and the factors that contribute to it could be work. What happens? You didn't get a promotion, you didn't get a raise, you didn't get the job you wanted, right? So violence in the workplace. What about education? I like how this is described at the beginning. Schools have assumed many responsibilities traditionally assigned to the family at home. Sexual development, disciplining are often now done at the school, right? Large classes often mean teachers spend more time monitoring behavior and disciplining kids than teaching. Okay. And we all know about school shootings. I just retired from the district that had Columbine. That was my first year in the district. Was when Columbine happened in Colorado. How does the media play a role? Right? How does the media play a role in potential violence? You guys tell me.
Hey, they got all type of, are you asking? I'm sorry.
Yeah, I'm asking, how does the
Oh,
media play a
okay.
role? How does the media play a role in violence?
It's these video games. They got like, have you ever heard of Grand Theft Auto? And kids is playing these games and they shooting and taking cars and all types of stuff. Just the things that they watch. So if it's not positive or, whatever, they pretty much want to mimic whatever is on TV, YouTube.
Yep. Music, organized religion, right? We see violence in places of worship, right? That's happening. And then the community itself, the population of the community is another factor. What if you live in a extremely poor, crowded community, right? The potential for violence and tension and things boiling over is probably pretty high. What if you live in a community that has a high gun violence rate, right? Youth may be dealing with feelings of powerlessness, gangs, poverty, lack of education, right? How do these kids deal with their feelings? By engaging in crimes, maybe to release their frustration. Gangs are a big problem. Okay. And then community facilities, right? Communities provide a large range of resources and facilities. If a community has if it's a desirable place to live, it has parks and rec centers and places for kids or people to go to do things that could potentially reduce crime and violence, right? Playgrounds, like I just said, playgrounds, parks, swimming pools, movie theaters, tennis, basketball courts. What if you don't have that? What are you left to do? Just kind of hanging around, nothing to do. Okay. And so what types of violence is this chapter addressing? It's addressing homicide. We all know what homicide is. It's addressing assault. Okay. Assault, the burden of the healthcare system with assault is incredibly high. Okay. And then sexual violence and rape. And then the last violence, area of violence would be hurt. Instead of hurting another, you hurt yourself, which is suicide. And I can tell you, coming out of 20 years in the schools, recently retiring from the schools, after what's happened over the last couple of years with our pandemic, the mental health and the suicide rates are through the roof. We all know that, right? We've all read about it, heard about it. Okay. And then let's touch on family violence and abuse. Okay, what does family violence look like? Well, it could include sexual, emotional, physical abuse. Can also cause significant injury and death. Right? So those are the three forms that we're going to address: sexual, emotional, and physical. Okay. Generally, I'm reading a lot of this because this is an excellent summary. Family violence is violence of the most powerful against the least powerful. Okay. Do you guys know how to would you know how to recognize a battered child or spouse in an emergency department? Okay. Unfortunately, by the time people are seeking care, it's usually in an emergency situation. Right. So nurses are in a key position to try and help with these abusive tendencies. Right. We need to be aware, we need to be educated, we need to be knowledgeable about the factors contributing to the development of abusive behaviors. Right. How did I identify abuse prone families in the school system? After a while, it became pretty easy. Okay. And school nursing is a community health nursing position. So this is one of the things that I was tasked with. You know, can I identify an abuse prone family? Do I have the right resources to communicate with kids and moms or whoever the victims are? Can I develop the communication skills? Did I develop the communication skills to be able to have conversations, those hard conversations? You know, when a kid shows up at your clinic in the morning, all bruised. Okay. So to help abusive families, nurses, we need to understand the factors that characterize people who become involved in family violence, right? Is it the upbringing? Is it living conditions? Is it increased stress? Okay. Types of family violence, right? Physical abuse, sexual abuse, neglect, child abuse. And box 25.1 is excellent. Abuse is about power and control. Okay. Some key words to remember here: isolation, threats. I want to be mindful of time here. Intimidation, using children, and being cruel. Okay, so have a look at these. That's what I want you to understand is these actions. You don't need to know all the bullets, but at least have a general understanding of these headers here: isolation, threats, intimidation. You guys can keep going. Using the kids, being cruel, withholding support, sexual abuse. Okay, and we all know we're mandated reporters, correct? What is a mandated reporter and what am I talking about?
Means if you suspect violence or trauma
to report
abuse, that you have to report it.
Is that when you're at work?
Not all the time.
Like even at the grocery store?
Even at the grocery store.
Absolutely. 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 Okay. Box 25.2, this is also excellent. Determining risk factors for child abuse. Okay, have a look at this as well. Here's some questions that you would ask. Ask yourself or ask them. Okay. How to identify abusive parents? Excellent box, 442. Really important if you're working in the community. This is part of your community assessment. Let's say you're doing a family assessment. Okay, let's say you've been called to the house to go with a police officer to do an assessment of a report that has been put in with Child Protective Services. You will do that as a community nurse. Okay, can you potentially identify what abusive parents might look like or sound like or talk like? Okay. And this is another good how-to box on page 444. How do you recognize actual or potential child abuse? Big, long list. Okay. I had to teach and train on this all the time with the staff in my schools. How do you potentially recognize actual or potential child abuse? No, they talk about child neglect, child abuse, intimate partner abuse, signs of abuse, hitting, kicking, punching, slapping. Go through and read all these. There's so many. Psychological and verbal abuse. So it goes through physical, psychological, and financial. Okay. And then we know that battering during pregnancy has serious implications. Okay, I just wanted to bring that up because it is such a problem and such an issue. Okay, but the last section in this chapter is the elder abuse. Sorry. How to identify? Have a look at this box, 447. How do you potentially identify elder abuse? Okay, you are going to get asked about elder abuse on your next exam. Okay, so have an idea what you're looking for. Okay, for all of you that work in long-term care, you've probably already experienced this, right? So, nursing intervention. So primary prevention begins with a community approach that incorporates strategies, okay, from several different areas in the community. You're going to be looking at pulling in criminal justice personnel, education personnel, social services, community advocacy, and public health to prevent violence. Okay, your job is to pull everybody together. Okay, so here's some examples of what some communities have used with regards to primary prevention. Okay, when it comes to violence and abuse. And there's 6 of these. And this is a starting point. But these are 6 primary prevention interventions that have been used. Okay, I want you to read through these and I want you to know these, please. Okay. Family programs that teach parents how to deal with their children more effectively. Preschool programs that develop intellectual and social skills. Right? And public education programs that educate communities about different forms of violence and ways to get help. Okay, nursing home visitation programs with families at risk that aim at preventing child abuse and neglect. 6 great primary prevention ideas here. Okay. Okay, that's it for that chapter. Any questions? That's a tough chapter. That's a tough chapter to cover. Let's talk about infectious disease prevention and control. Okay. We've talked about transmission before with the agent, the host, and the environment. We'll talk a little bit about modes of transition. How do we surveil? What are some primary prevention and control of communicable diseases? Primary, secondary, tertiary. We'll go through that. Okay. Okay, let's jump to the Healthy People 2020 box on page 457. Okay. There's 4 objectives related to immunization and infectious diseases. Okay. So please know those. Okay, we've already talked about the transmission, right? We know what an agent, host, and environment is, right? Right? We know that the transmission of any communicable disease depends on how that agent, host, and environment all interact. Right? Changes in the characteristics of any of those agent, host, environment will result in some kind of disease transmission, whether it's not serious, whether it is serious, depends on how all those 3 interact. Okay. And this just goes through we're not going to go through this. We've already gone through this in the last chapter last week. Okay. So what we need to know here are the modes of transition. Okay. So I want you to read about these because we're getting close to where I want to kind of try and wind down here, but we need to know these 4. Okay. What are the modes of transmission for infectious diseases? Okay. It's a nice summary of these right here. Okay. Now we need to know how the disease is occurring. Please, we need to know the difference between endemic. Well, what's endemic? What do you guys know? What's epidemic? What's pandemic? And endemic? Pandemic is what we've just been through. An epidemic refers to an epidemic that occurs worldwide and affects large populations. That's our pandemic. Right? An epidemic refers to occurrence of a disease in a community or a region. Right? And then endemic refers to the constant presence of a disease within a geographic area population. What's an endemic? Give me an example of an endemic.
Like in the elderly population, maybe diabetes.
How about
No.
flu? How about the flu?
Flu, yeah, flu.
Flu is always going to be around. Right? How do we surveil? Okay. So when we're doing surveillance, we gather the who, when, where, what. Right? And when we gather the who, what, we've already talked about this. Remember this in the epidemiology chapter? And then we use the who, when, where, what, then use to answer why. Okay, and read this with thinking of ADPI. A good surveillance system collects, organizes, and analyzes data for a defined disease condition, right? Once we have all that information, we can promptly release to those who need it for effective planning, implementation, and evaluation of the disease prevention and control programs. So here's your summary of surveillance of communicable diseases using the ADPI. Okay. Then it asks us to jump to box 26.2 to list the 10 commonly used data elements. So we're going to go there. Okay, so here's the 10 basic elements of surveillance. What are we looking for? Okay, how are we going to gather our information? Okay. When we're working with families, how to prevent infectious diseases in your home. Wash your hands, disinfect surfaces, handle and prepare food safely, get immunized, use antibiotics appropriately, be careful with pets. Okay. This I'm going to have you read on your own because I've highlighted from, this is an excellent, excellent summary of primary, secondary, and tertiary. Okay. And this is in regards to the control of infectious diseases. Okay. And it goes through primary, secondary, tertiary in detail. So this is on page 463. I want you to read this whole section all the way down through the box. Okay. Obviously, I'm not going to cover these, but this chapter goes through agents of bioterrorism. So it goes through anthrax, smallpox. Okay. The other thing I wanted to cover was vaccines. Okay. We know, and this is a fact, that vaccines are one of the most effective methods of preventing and controlling communicable diseases. Anybody argue with that? For purposes of this chapter, that's how we look at vaccines. Okay, so we think of diseases such as polio, diphtheria, pertussis, measles, which have previously occurred in epidemic proportions, are now controlled by immunizations, right? In the United States, there's a program called No Shots, No School, right? That kids are not supposed to be in school if they are not updated with their immunizations by the time they enter kindergarten. However, this is important right here. Many infants and toddlers, which is a group most vulnerable to these potentially severe childhood diseases, don't receive their immunizations, even if despite the availability of free vaccines. Okay, why is that? It tells you right here. So if you're asked a question about, yes, we want everybody vaccinated, but what might be some barriers to kids not getting vaccinated? Here's some barriers right here. Inner city children from minority and ethnic groups are particularly at risk for incomplete immunization. Children from religious communities whose beliefs prohibit immunization, and children with parents who have philosophical objections. So what do you do if you're the school nurse or you're the immunization nurse at the public health department and you have parents that don't want to immunize for whatever reason? And they want to fill out a personal exemption, medical exemption, religious exemption. You know, the only thing you can do is try and educate them with this. Vaccines are one of the most effective methods for preventing and controlling diseases. All you can do is try and educate them. But you are going to have parents that do not immunize, and that is their right to do that. In the schools, they fill out a exclusion paperwork. So they aren't excluded from school. They have to have a doctor do a medical exemption. Religious, they just fill out, and personal, they just fill out for whatever reason. Okay. Then it goes through all the childhood diseases. Okay. Okay, your QSIN, your quality and safety education competency for this chapter is safety. Okay. And the safety, it talks about vaccines, in particular pertussis. Okay. So that's it for that chapter. Yeah, we don't need to go through the rest of that. And then the last chapter to cover is there's a chapter this chapter 27 specifically talks about HIV, hepatitis, TB, and sexually transmitted diseases. So I'm going to ask you to go through this chapter. I want you to review Healthy People 2020 in here. Okay. I would like for you to study the objectives in here. Okay, this is what I need you to know about this chapter. Okay, what are the clinical signs of HIV, hepatitis, STDs? Right, what groups are at greatest risk for these four? What can we as nurses do to prevent these diseases and care for people who experience them? Okay. Clinical signs. All right. So are you guys okay with delving into that chapter on your own? Okay, and look at your 5 objectives. That's what you need to know. That's what I would have just covered with you. But since I promised we were going to get out a few minutes early, so you had time to get ready for your PEDS exam, I want to hold to that. If everybody would just go to their your week 7 attestation, please. Trying to get there. What's the first question? The quicker we
Sorry.
can do this, the quicker we can get out.
What are the
When
signs?
discussing,
When discussing family violence, what are some signs of abuse?
bruises,
Bruises and berries.
burns,
Yep.
Page 444 has that little box that has a lot of them.
Okay. Page
Social
44.
withdrawal.
Dehydration, malnourishment without obvious causes. Unusual fear of nurses or others. Considered to be a bad child.
Yeah.
Whiplash. Injuries that are healing in different stages.
Okay. That's enough. So put those in there. That's excellent. Thank you, Alex, Brendan, Alex.
And then the next one is asking about the emerging infection diseases, and that is on page 462. There's a box with tons of them you can pick from.
Well, let's pick the 4 that was the last chapter that you guys are going to cover. Right? HIV or HIV, TB. Well, actually, where are you looking at, Alex?
Page 462, it just says examples of emerging infectious diseases.
Yeah, but I think we're
Yeah,
Okay.
it has HIV on there, influenza, SARS, West Nile.
Oh, that's it. Those are the 4 right there. Those are them. What page are you on?
462.
462. Okay. Yes, that's it. There's a PowerPoint in your PowerPoint presentation. It's on there. Okay. 462. Yeah, there they are right there. So your emerging infectious diseases are HIV, influenza, West Nile, and I'd have to go back to, hang on, Ebola. That's the other one. I have them highlighted right here. Okay. So those are your answers to the second question.
You said HIV, influenza, Ebola, and
West Nile. Yes. Those are your 4 emerging infectious diseases. Okay. So everybody hit submit. If you don't hit submit now, make sure you get it done before tomorrow. If your name isn't in the chat, get it in there now before we end. I'll stay on. If anybody has any questions, I want to give you guys the gift of 15 minutes to get ready for your PEDS exam. But you're on your own with chapter 27, but just let the objectives guide you. Okay, don't need to read the chapter from start to finish. Okay, just get the objectives answered, and then that's what you need to know out of that chapter. Okay, anybody have any questions?
Professor Marble,
Yeah,
were you just, the last email I got from you is that for me to get on before your class tomorrow, right?
yeah, hang on 1 second, Brittany. I just want to excuse everybody. Does anybody have any general questions that will benefit everybody? If not,
you,
good
Professor.
luck. Good luck. You're welcome. Good luck on your PEDS exam, whoever's taking it.
Thank you.
Thank you.
All right, talk to you guys later.
Thank you.
You're welcome.